And October is Diabetes Awareness Month. Millions of Americans are impacted by diabetes, prediabetes, and obesity. In fact, the CDC says 16% of U.S. adults live with diabetes, and millions more are at risk. All this while Americans face a healthcare system that focuses on symptoms and treating the symptoms instead of the root causes so you don't have the problem to begin with. Dr. Sherry Ogwo is a physician who is triple board certified in internal medicine, endocrinology, and obesity and metabolism. And it's great to have her on. Good morning to you, Dr. Ogwo.
Good morning. How are you?
I'm good, thank you. I speak to you as a man who weighs 185 pounds now, who used to weigh 360, and who had slightly unstable. I was just before pre-diabetes, and so they put me on the baby dose, the 0.25 of Ozempic. But happy to
Yes,
say
sir.
that since I'm on that and Armour Thyroid, my thyroid is perfect. I have to give you the full report. Thyroid is perfect, and the sugar levels are perfect. I'm waking up stable, and I'm 185 pounds. But I say that
Wow.
because there is, and I'm no longer considered pre-diabetic. There is a real, I mean, this is a serious healthcare crisis. I know 10 friends who are all pre-diabetic. What is going on, and why has America gotten to this point?
So it's a combination of a few things. It's the industrialization, and it's we're moving less and we're eating worse than we've ever eaten.
Mhm.
So people are more sedentary. Our foods are more processed. We're also reaching for foods that are quicker to get. Less natural. And this is all because people are working harder too. And, and that's all culminating to this diabetes crisis that we're seeing.
Mm, clearly, I mean, the more you process the foods, the more you get the sugar spikes, right? And that just impacts it causes insulin resistance. I mean, I'm no scientist,
It
but
does.
just from what I'm reading and seeing, clearly is the case. What is the care model like now in the U.S. for diabetes?
So the care model right now is very reactive, and that's part of the problem. So we're waiting until people become pre-diabetic, and even sometimes until they're fully diabetic before we start instituting changes or recommending even lifestyle changes or even starting them on therapy that potentially could change the trajectory of things. Before a person becomes pre-diabetic, just like you said, it starts with insulin resistance.
Mhm.
And a person can be insulin resistant for years and years before the A1C starts to, move towards the pre-diabetic range. And there is a way to test for this, but most people don't test for this in everyday medicine. And you end up with, by the time they come to you now, the A1C is much higher. And a lot of times we give them metformin. Maybe this patient, like you said, they weigh 200, 300 pounds. If we can tilt that weight and get them to where they weigh less, which we have so many great medications now out there that can help with this. Give very specific lifestyle instructions, not just eat right and exercise. um we can actually reduce or start to make the patient become more insulin sensitive, which ultimately helps with diabetes reversal and even prevention.
Amazing. And I will say this, even though I mean, I've done it all, doc, from when I was 360 pounds. I had a Roux-en-Y gastric bypass back in
Okay.
2003. I'm a mess. I'm your perfect person. Uh, and then, or maybe not, maybe just the opposite. I had the Roux-en-Y that got me down about two-thirds of the way, but then I kind of
Okay.
froze, but I maintained like 240 pounds for years. And then did some intermittent fasting that got me down a little more. And then the Ozempic got me down to where I am. And I will say this.
Mhm.
Once I broke the 200-pound mark, I'm 6'3". I broke the 200-pound mark and now I'm down to 185. I crave vegetables. I crave them. I crave fruit. I crave and I've lost the taste for most meats. I'll have a little chicken or a little fish. All my old cravings, fast food, like, no offense to the fast food companies, like it's all gone. So there's something to be said. It's like one, you don't know what causes the other, but there is something to be said for just you start eating right, and it's like a roller coaster. You start wanting to continue to eat right.
You are absolutely correct. And this is because of our relationship honestly with food. when we're using processed foods and high sugar foods, high carb foods to trigger dopamine release in the brain,
Mhm.
then what happens is more begets more. The more you eat those things, then the more you're seeking that dopamine hit. And eventually you start to numb the receptors, excuse me, to where you need more and more to get the same feeling, the same feel good feeling that you get from dopamine, because that's our feel good hormone.
Mhm.
Foods triggers, or our foods have does have a relationship, excuse me, with dopamine, with serotonin. These are all neurotransmitters in the brain that make us feel good. So when you
Amazing.
eat less of those foods, then you reset your transmitters, your receptors, to where the good foods, the better foods, now give you the same dopamine hits. Exercise gives you the same dopamine hits, and that's where we all need to slowly get to.
I know a lot of people don't want to hear it. They go, meh, 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 meh," when they go to
I
their
know.
doctor, right? Because it involves a little
Yes.
change, and change is always a little pain in the neck on day one. But once you, like you're saying, once you get into it, it's like, boom, you then look forward to it. You go to the market, all of a sudden you go to different parts you never went to before. And you're saying, I've never tried that
Yes.
vegetable. And you try it. And all of a sudden you say, where's this been all my life? I love it. It's just amazing. And I know you provide online care as well, and you try it more holistic approach. Tell us more about the holistic approach to your patient care.
Yes, sir. So holistic treatment does not mean that we are not using the more allopathic medications, but what it means is that you look at the whole person. I'm looking at you as more than just the number. I'm not just looking at your blood sugar numbers. I'm not just looking at your A1C levels. I'm looking at how is stress affecting this number that I'm seeing today? How is lack of sleep affecting insulin resistance? Do we have a mental or emotional strain that is not allowing this person in front of me follow the path that we've set? And so, because human beings are not just numbers. There's so many
Mhm.
things that number is telling a story of, so many things happening in the background. And how can we bring it all together, looking at not just the sugar? I'm an endocrinologist, that's why I keep saying sugar, but
Mhm. Yeah.
also the kidneys, the nerves, the heart. How are all the organs affected by this blood sugar number that I'm looking at right now?
Yeah. And by the way, having had gastric bypass, I see an endocrinologist twice a year, and you have to, because if anyone who's had any kind of a weight loss surgery, you have to make sure you maintain your nutrition levels because they tend to drop right
Absolutely.
sharply. So I have to take,
Yes.
all the iron in the morning, calcium in the evening. I do the whole thing, and you have to, because otherwise, I've seen people with gastric bypass get very sick. Otherwise, as I'm sure you have, you just have to be on
Yes,
top of
sir.
it. We're our own number one advocate. Doctor, what is a website for you for
Absolutely.
more information? So if people want to reach out or find out more from you.
Okay. If you want to find out more from me, you can go to www.sherrymd, so CHERIMD.com, for more information.
Awesome. And I love the name. That means cherished in French, right? Chérie. There you go.
Yeah,
My
it
cherished.
does. Yes, sir.
Awesome.
Absolutely.
Well, you are cherished for a reason. You are a triple board certified physician in internal medicine, endocrinology, obesity, and metabolism. Dr. Sherry Ogwell, please come back. This is such an important topic. I think we really need to talk more about it, especially with the holidays coming up. And I know people want to indulge. You could indulge, but you could still be careful. We need to talk more with you about that. Would you come back,
Absolutely.
please?
Yes, sir.
All
Yes.
right. We
Yes, sir.
appreciate you.
Anytime.
All right. Doctor, have a wonderful day. And thank you for coming on today. We
Thank
appreciate you.
you. Thank you for having
Thank you.
me.
You bet. Very important. I mean, as the ancient physician said, your what you eat is your best medicine. So that is essential. And speaking as somebody who was nearly 400 pounds, it's all you could go. I was on that teetering edge where I could have gone that way and had massive problems or had to change. So you got to keep on it.